Welcome to Diabetes Nutrition. My name is Jamie and I'm a registered dietitian here to facilitate this workshop, which is provided to you by the Edmonton Primary Care Network. As part of the medical home concept of care through a family physician and the interdisciplinary services provided through Edmonton Primary Care Networks, welcome to this workshop. Let's get started.
Welcome to your medical home. When you walk through our door, we get to the heart of all your healthcare needs. Your family physician is the key to your medical home and knows you best. As a member of a primary care network in Alberta, your family physician can access a dedicated team of health professionals who together can provide you with the care you need through every stage of your life. Your medical home is where you can get reliable care you can trust at any time of the day, including accessing after-hours care without having to visit the emergency department. Your medical home is also where registered nurses, pharmacists, mental health professionals, dietitians, and other health professionals work with you to keep you living your healthiest life. By managing chronic disease and offering continuous care through your family physician, with links to specialists, hospital procedures, and treatments, providing earlier detection of disease and improving access to the care you need when you need it. So welcome home. We're glad you joined us.
This workshop will focus on how foods affect blood sugars and healthy eating for diabetes. The workshop will also include information about what is diabetes, risk factors, and basic tips for managing blood sugars. The information in this presentation has been adapted from the following resources: the Clinical Practice Guidelines for the Prevention and Management of Diabetes in Canada, and the Canada's Food Guide. You can access these references by clicking the links that are posted on the PCN website where you will find this presentation. They are also listed at the end of this presentation. Often people find it helpful to have a pen and paper ready to take some notes. If you haven't done so, please take a moment to pause the presentation and print the handouts from the website so you can follow along. Type 2 diabetes occurs when the pancreas does not make enough insulin or when the body does not use the insulin well. Much like a key, insulin acts to unlock the door to the body cells to let sugar or glucose in so that it can be used for energy. When there isn't enough insulin or insulin isn't working properly, sugar or glucose builds up in the blood instead of being used for energy. Over time, high blood sugar levels can cause complications such as eye disease, heart disease, kidney problems, and nerve damage. Fortunately, good diabetes management can help to prevent or delay these complications. Several methods are available to screen for diabetes and are shown here in this table. Usually, 2 abnormal blood tests are needed to make a diagnosis of diabetes. Diabetes is diagnosed when fasting blood sugar, or glucose, is 7.0 or greater, or hemoglobin A1C is 6.5% or greater, or 2-hour oral glucose tolerance test is greater than 11.1, or random blood glucose is 11.1 or higher. There are several risk factors that increase the likelihood of developing type 2 diabetes. Some of the risk factors include age, having a first-degree relative with type 2 diabetes, being a member of a high-risk population, which includes Indigenous, African, Asian, Arab, Hispanic, South Asian, or those of low social economic status, having other health conditions such as prediabetes, heart disease, obesity, sleep apnea, or polycystic ovarian syndrome, having a history of gestational diabetes, and taking medications associated with diabetes. The earlier you are diagnosed, the sooner you can take action to stay well. If you are 40 years old or older and have other risk factors, you should be tested more often and/or start screening earlier. Signs and symptoms of diabetes include unusual thirst, frequent urination, weight change, extreme fatigue or lack of energy, blurred vision, frequent or recurring infections, cuts and bruises that are slow to heal, tingling or numbness in the hands or feet, trouble getting or maintaining an erection. It is also important to note that many people who have type 2 diabetes may not have any symptoms. Several behaviors help to manage your diabetes. These include monitoring blood sugars, enjoying balanced meals and snacks, enjoying regular physical activity, maintaining your best weight, taking diabetes medications as prescribed by your doctor, managing other health conditions such as high blood pressure and high cholesterol, and working towards quitting smoking. This workshop focuses on healthy eating for diabetes and learning how food can affect your blood sugar. Getting education and support from your healthcare team is an important step in managing diabetes. A blood glucose monitor is used to check your blood sugars at home. You can get these meters from most pharmacies. Talk with your healthcare team within your medical home or pharmacist about which monitor may be best for you and to learn how to use your meter. Checking your blood sugar gives you a quick measure of your blood sugar at any point in time. Monitoring your blood sugars will help to get a better understanding of what affects your blood sugars. It is helpful to keep track of your blood sugars and look for patterns and factors that may have affected blood sugars. Things that may affect blood sugars include the foods you eat, stress, illness, and/or medications you did or did not take. Talk to your healthcare team about how often and when you should check your blood sugar levels. The target blood sugars listed on this slide are a guide and not meant to replace advice and information from your healthcare team. Please discuss your personal blood sugar targets with your family doctor. The A1C is a measurement of your average blood sugar control for the last 3 months. For most people with diabetes, an A1C of less than or equal to 7% is helpful in lowering your risk of developing complications of diabetes. Please discuss your personal blood sugar targets with your family doctor. Food is an important part of managing blood sugars. Some of the important things to keep in mind are regular timing and spacing of meals and snacks, choosing whole foods, preparing foods at home, choosing high fiber foods, choosing healthy fats, limiting sweet foods and added sugars, and limiting salt and salty foods. A variety of eating patterns and foods have been shown to be of benefit in people with diabetes. It is encouraged to choose an eating pattern that you enjoy and can maintain long-term. The starting point of nutrition for diabetes is to follow the Canada's Food Guide Healthy Eating recommendations. The Canada's Food Guide suggests to eat a variety of foods each day. Choose more vegetables at meals and snacks and aim to fill half your plate. Fresh, frozen, or canned can all be great options. Choose lean animal protein and choose proteins that come from plants more often, such as legumes or tofu. Choose whole grains, such as whole grain bread and pasta, quinoa, or oatmeal. Choose whole foods and less processed foods. Replace sugar-sweetened beverages with water. Prepare meals at home and choose ingredients with little or no added salt, sugar, or saturated fat. Being mindful of our eating habits helps us to enjoy our foods, taste the flavors and textures, and notice when you are hungry and full. We all have our own likes and dislikes, culture and traditions, cooking knowledge and skills, nutrition needs, budget, and treatment options and health goals. A registered dietitian can help you to plan an eating pattern to help you meet your nutrition and blood sugar goals. It is important to consume fiber from a variety of foods. Fiber is found in foods such as whole grains, vegetables, fruits, and legumes. Fiber helps to delay the rise in blood sugars after meals, helps to lower cholesterol levels, and helps to keep you feeling full. Adults with diabetes may aim for 30 to 50 grams of fiber daily. When increasing fiber, it is recommended to increase fluid intake to promote healthy digestion and increase fiber slowly so the gut can adjust. The type of fat you eat is more important than the amount of fat you have. When including fat, it is best to choose plant-based or unsaturated fats while limiting animal fats or saturated fats and avoiding trans fats. Some examples of plant-based or unsaturated fats are canola oil, olive oil, nuts and seeds, and avocados. Omega-3 fats are beneficial for heart health and are found in fatty fish such as salmon, sardines, mackerel, and herring, as well as in chia seeds, flax seeds, and walnuts. Types of foods to limit that contain animal or saturated fats include marbled meats, chicken skin, sausages, bacon, full-fat dairy products, coconut and palm oil, hard margarine and shortening, baked goods, and processed foods. Wherever possible, it can be helpful to replace animal fats with plant-based fats. Individuals with diabetes are at a higher risk for heart disease, and a higher sodium or salt intake can lead to high blood pressure. A healthy blood pressure is important to protect the heart. Limiting sodium intake can help to improve blood pressure. Aim for less than 2,300 milligrams or less per day. Sodium is often added to preserved foods and for taste. Most of the sodium we eat is found in restaurant and fast foods and processed and packaged foods such as frozen meals, snack foods, or processed meats. To help reduce sodium intake, choose whole foods, prepare foods at home, and choose foods with little or no added sodium. Sugars are found naturally in foods, such as white milk, fruit, and foods where sugars are added during processing and preparation. These sugars are called free or added sugars. Having high amounts of free sugars as processed foods and/or sugar-sweetened beverages may increase the risk of developing type 2 diabetes. Diabetes Canada recommends to limit free sugars to 12 teaspoons per day. The average can of pop has about 10 teaspoons of sugar. Limit sugar-sweetened beverages like pop, iced tea, and specialty coffees, and choose water in their place. Choose whole foods, prepare foods at home, and choose foods with little to no added sugars. Sugar substitutes, which include high-intensity sweeteners such as aspartame, sucralose, or stevia, and sugar alcohols such as sorbitol and xylitol, are regulated as food additives in Canada. They have been approved by Health Canada for use in foods, chewing gum, and/or as a tabletop sweetener. Most have been shown to be safe when used by people with diabetes. Health Canada has set acceptable daily intake values and are considered safe daily intake levels over a lifetime. These levels are considered high and are rarely achieved. Please refer to the handout from Diabetes Canada called Sugars and Sweeteners for more information. Food labels give you information to help you compare foods and make healthier choices. Check the serving size, which is listed at the top of the nutrition facts table. All the information in the table is based on this amount. Compare this to the amount you eat. Check the percent daily value. 5% or less is a little, and 15% or more is a lot. Choose foods with a little fat, saturated fat, and trans fat and sodium. Choose foods with a lot of fiber. Use the serving size and the percent daily value to compare and choose foods that meet your health and nutrition goals. Now that we have discussed some of the basics to healthy eating, we're going to discuss how foods affect your blood sugar in more detail. Foods are made up of carbohydrates, proteins, and fats. Carbohydrates are found in grains, starchy vegetables, legumes, milk, yogurt, fruit, and sugars. Carbohydrate-containing foods will have a bigger effect on blood sugar. Therefore, it is important to spread these foods over the day. Protein and fats do not raise blood sugar. Proteins include meat, fish, poultry, dairy products, and legumes. Note that legumes contain both a carbohydrate and protein. Fats are found in meat and dairy products, oils, and nuts and seeds. Including carbohydrates with lean protein and plant-based fats at meals will help to keep your blood sugar from rising too high. Choosing foods with fiber at meals will also help to control blood sugars. Protein, fat, and fiber help to slow down how fast we digest carbohydrates and limits how much our blood sugar rises. The glycemic index is a scale that ranks a carbohydrate-containing food or drink by how much it raises blood sugar levels after it's eaten or drank. Foods with a high glycemic index raise blood sugar higher and faster than foods with a low glycemic index. There are 3 glycemic index categories. Green means choose more often. Yellow means choose sometimes. Red means choose less often. Include low glycemic index foods such as legumes, whole grains, and fruits and vegetables. These foods can help control blood sugar and cholesterol levels. Please refer to the handout from Diabetes Canada, Glycemic Index Food Guide, for more information. There are 3 types of carbohydrates: sugar, fiber, and starch. Among these 3, only sugar and starch will raise a person's blood sugar. Fiber will not raise blood sugar and can help slow the rise in blood sugars after a meal. Knowing that only sugars and starches raise blood sugar and that fiber does not is an important piece of knowledge that can be helpful when trying to figure out if and how much food will raise your blood sugar. We will use this knowledge when we talk about carbohydrate counting and label reading on the next slide. For the following 3 slides, I will review the basics of carbohydrate counting. Please refer to the handout from Alberta Health Services, Diabetes Healthy Meal Planning. Beyond the basics of healthy eating for diabetes, some individuals with diabetes may benefit from learning and using something called carbohydrate counting to help with meal planning. Not everyone needs to count carbohydrates. However, having basic carbohydrate counting skills may be helpful in managing diabetes. The amount of carbohydrate in a food is listed on the nutrition facts table, and the amount listed is for the serving size given. Compare the serving size to the amount you eat. The total carbohydrate amount listed includes sugar, starch, and fiber. You may have noticed that on most food labels, starch is not listed underneath the total carbohydrate. Starch is not required to be listed on nutrition facts tables. Fiber does not raise blood sugar and should be subtracted from the total carbohydrate amount. How do you figure out how much blood sugar raising carbohydrate is in a food? Blood sugar raising carbohydrate is also called available carbohydrate and includes both sugar and starch. To determine how much available carbohydrate is in a food, subtract fiber grams from the amount of total carbohydrate. We will go through an example on the next slide. Using the label on this slide as an example, we will calculate the available carbohydrate. There are 36 grams of total carbohydrate and 11 grams of fiber. Subtract the amount of fiber from the total carbohydrate to get the amount of available carbohydrate. There are 25 grams of carbohydrate that will raise blood sugar. When foods do not have a label, knowing which foods have carbohydrate can help you determine how much carbohydrate is in the foods you eat. A carbohydrate choice is the amount of a certain food that has about 15 grams of available carbohydrate. Some examples of one carbohydrate serving or choice are half a cup of cooked pasta, 2 cups of strawberries, or 1 cup of milk. Please refer to the handout from Alberta Health Services, Diabetes Healthy Meal Planning, for other examples of one serving of carbohydrate foods. Everyone needs a different amount of carbohydrate, and you may have your own individual carbohydrate goals based on things such as calorie needs, physical activity levels, and/or your health goals. As shown on this slide, one carbohydrate choice is equal to 15 grams of carbohydrate. The chart pictured here shows grams of carbohydrate as well as carbohydrate choices. You may prefer to use one or the other based on what works for you. The chart can be used as a guide for meal planning and carbohydrate counting. A registered dietitian can help you to plan a goal for carbohydrates at meals and snacks. The chart on the slide can be found in the resource from Alberta Health Services called Diabetes Healthy Meal Planning. Checking your blood sugar levels before eating and 2 hours after a meal is a great way to know how your body handles certain foods and drinks. Canada's Food Guide can help to guide food choices for balancing meals and spreading carbohydrate choices over the day. A registered dietitian can help develop personalized nutrition goals to help improve blood sugars. Check out your own Primary Care Network's website for a list of health workshops. Some workshops might be available virtually, while others in person. You are also welcome to get a referral from your PCN family doctor to set up an appointment with a health professional, such as a registered dietitian, exercise specialist, behavioral health consultant, or social worker. Alberta Health Services also has a variety of health workshops available. Call the booking line number or check out the Alberta Health Services website for the latest information on workshops and how to register. In closing, here are the references this workshop is based on. They are also posted on the PCN website where you found this presentation. Thank you for attending the Diabetes Nutrition Workshop. Your medical home is here to work with you to take care of your healthcare needs. Have a wonderful day.